Daniel Paroso. Daniel Barroso, wala din. John Bryle.
Present po, ma'am. Afternoon po.
Class, sandali lang, class. Magtawag daw muna si Ma'am, si Ma'am Sukwano. Sandali lang. Okay, sorry for the interruption. Bryle, nandiyan si Bryle, no?
Yes po, ma'am.
Okay, sige. Si Daniel, ma'am, hindi ka daw po narinig ni Barroso po. Ayusin niya daw muna audio niya. Okay, sige, Steph, noted. Christine Bretanya.
Present po, ma'am.
Okay. Melanie Cabriadas. Okay, present si Melanie. Ivan Kagampang.
Present po, ma'am.
Okay. Stephanie Calios.
Present po, ma'am.
Christine Concepcion.
Present po, ma'am.
Faith Donaire.
Present po, ma'am.
Giancarlo Fabiana.
Present po, ma'am.
Okay. Mary Grace. Grace.
Present po, ma'am. Thank you.
Okay. Van Allen Hamero.
Good afternoon, ma'am. Present po.
Good afternoon, Van. Beatriz Librero. Bea. Wala si Bea. Okay. Cyril Maghanoy.
Present, ma'am.
Okay. May Marie Mangubat. Okay. Jillia Rimorcia. Jill? Wala pa si Jill.
Present,
Okay.
ma'am.
Present.
Present.
Okay. Kayla
Present
Nime.
po, ma'am.
Opo. Kayla?
Present po, ma'am.
Okay. Camille Pansit.
Present, ma'am.
Okay. Allen Papelera.
Present, ma'am. Good afternoon.
Good afternoon, Len. Paulino Zarina.
Present po, ma'am.
Okay. Luis Placido.
Present po, ma'am.
Okay. Roan Razonable.
Good afternoon, ma'am. Present po.
Good afternoon, Ann. CJ Romano.
Good afternoon, ma'am. Present po.
Okay. Jillia Sab.
Good afternoon, ma'am. Present po.
Good afternoon, Jill. John Christopher Salido.
Good afternoon, ma'am. Present po.
Okay. Gwen Salva.
Good afternoon, ma'am. Present po.
Good afternoon. Princess Santiago. Princess? Wala pa si Princess.
Present, ma'am.
Present. Okay. John Rommel, subing-subing.
May hapon, ma'am.
Bing,
Present po.
okay, Bing. Chantel, sukal dito.
Present po, ma'am.
Okay, Shan. Norjen Sundungan. Ay, nandyan si Norjen? Wala. Crizel Tabsing.
Present, ma'am.
No. Paano yung boses mo, Crizel? Okay ka lang? Okay. Okay, sige. Preserve your voice na lang. Okay. Earthsea Takuyan.
Present po, ma'am. Good afternoon po.
Good afternoon, Earthsea. Kayla Villodres.
Present po, ma'am.
Okay. Jasmine Yap.
Present po, ma'am.
Okay, sige. So, balikan natin. Bea, wala pa rin si Bea.
Meron na po. Present po,
Andyan na si Bea. Okay. What about Christine Advincola? Nakapasok na?
Good afternoon, ma'am. Present po.
Okay, good. Sige. So, for this afternoon, we will be discussing a new topic. Okay, a new topic, but this is just a short discussion. Okay, short discussion about emergency drugs, which is part of your finals. Okay, gamay na lang yun. In 4 weeks time, okay, we will have our finals exam. Maupagani pagsugod sa ato pag human sa midterm, magkuna-una na kag-finals. Okay, priming ang tawag anak class. Okay, hay na lang ma'am, di na jud ta kaginhawaan ni. Okay, gamay na lang jud push class. Okay, so for the finals, shorter ang ating coverage ng exam, not like the midterms exam. And really, I am so sorry. Okay, I'm so sorry, ma'am. Musta among midterm exam? Okay. To be honest, class, with regards to your midterm exam, not only this section, but majority of students who's taking, okay, NCM 206 sa midterm exam talagang tagilid. Okay, in our class, we only have, let me verify it. Okay. 1, 2, 3, 4, 5, 6. Okay. Only 6 people passed the exam. Sa PICA section ako, 10. Actually, I am one of those who made the exam, but that is not my questions. Okay? Those questions that majority, okay, is from Ma'am Heronan. Okay? Kasi kahit si Sir, kahit si Sir Ebero, okay, kasi tag 35 kami, yun ang hinihingi kasi hati kami dapat kasi 100 items. So 35 items namin ni Sir Ed, 10 lang ang kanya, 10 ang akin, the rest is from Ma'am Heronan. Kasi they are going to screen, okay, they are going to screen the exam, okay, the test questions that we are making, and then yun na. So it's really out of our control. So yan. Later, okay, I will give you your, kasi, di ba, yung quiz na kitake ninyo ngayon, that is part of your midterms. So after I do the computation or the entry of the quiz, okay, patapos na yun na lang quiz ang inaantay ko. I will have your midterms and then I will send to you your grades later. Okay, hopefully. Okay. So, for the finals we will be having 6 topics only. Yes, I will be giving you later, kagaya nung prelims, I will send you message. I-PM ko sa inyo lahat, your score in the exam as well as your final grade. And by the way, ang final grade ninyo is 1/3 from the prelim and 2/3 from your tentative midterm grade. So, ang ibibigay ko na sa inyo is yung final grade na maglabas sa automated. Yung sa portal na mismo. Okay? So, if you have questions, you can send me message naman. Okay? So, yun nga. For the midterms, for the finals, we have anti-TB medications, respiratory medications, GI medications, anti-diabetic medications, pain and inflammation, yung mga analgesics natin, and mga steroids. Okay, ma'am, double check ka po sa Quipper quiz. Yes, of course. I am always counter-checking your Quipper quizzes. Okay? So, kung ano man, okay, maningkamot lang yun ta. Okay? I will help you for as long as you will do your best as well na tawag nito, na you do your effort. Okay? Hindi lang kay puro si ma'am. Okay? Show me as well that you are really deserving to pass this subject and I will also help you. Okay? So, meron lang isa, si Norgen kasi hindi pa naka-exam si Norgen. So, hindi ko pa ito ma-post sa portal. Okay? So, ibibigay ko lang sa inyo ang grades inyo later. Okay, after I do the computation. Yun na lang ang inaantay ko, pati yung quiz ninyo. So, shall we proceed now with our new topic? Okay. Okay, so talking about emergency medications, dili lang ni siya pang emergency room ha. This is found everywhere in the hospital. Okay? Maskin tawag ani ka ng maskin sa ward na atay mga emergency meds. Kasi nga, syempre, we don't know what will happen to our patients. Ngayon, completely fine imong patient. After a couple of minutes, hindi natin alam, your patient may have arrest. Okay? That's why emergency medications are really important. And it's really important for you to know about these medications kasi nga, you should know what are the functions or the effect that this will contribute to your patients. Each time you will encounter patients who are undergoing cardiac arrest in particular. Okay? So aside from that, meron tayong computation dito. Not only drug computation, but how you are going to administer medication. So ano ba ang mga emergency meds natin? There are a lot of emergency medications, but we only incorporated few. Okay, na dapat namin bigyan ng emphasis sa inyo. Actually, I already added on this kasi nga doon sa syllabus, there's only few medications. Okay? And then, hindi siya, tawag nito, hindi siya completely explained doon. So, ginagdagan ko na ito siya. Para at least, when you will be exposed to the hospital, I'm sure some of you are already exposed, okay? You will have the knowledge, okay? You will have the knowledge as to how these medications work, okay? So let's start with our epinephrine. Epinephrine is one of the most common emergency drugs that we are using. And this epinephrine, okay, sa hospital, we have, I told you, diba, may e-cart tayo, yung ating emergency cart, which contains our defibrillators, mga medicines, mga supplies we will be using. For example, there's a need for intubation, for suctioning, okay? Lahat nandoon sa ating e-cart. Pati mga cardiac boards natin for possible CPR. Sa e-cart yan, para isang hilaan na lang pag emergency. Doon sa top portion niya, nandoon nakalagay yung mga medicine. And number one, ang pinakauna talaga na nakalagay dyan is your epinephrine. Why? Because epinephrine is, especially if your patient is on cardiac arrest, ito yung ginagamit natin. Because why? Because why? Epinephrine will counteract, okay? Counteract your cardiac arrest. Okay? It will reverse the cardiac arrest. Yun talaga ang function ng ating epinephrine. It falls under the classification of sympathomimetic. Okay, when we say of sympathomimetic medications, okay, this means that they tend to rise or to raise the blood pressure of our patients to a certain extent na nagiging alarming na din siya paminsan. Kaya every time we are giving these epinephrine medications, we really have to check the blood pressure of your patient. Kasi kapag hypertensive ang patient mo, whether nag-arrest man na or wala. Kung nag-arrest, okay. But if not, okay, nyari nag-order lang si doc na give epinephrine, ingon ana, labaw na sa OR, nagahatag ni og epinephrine. Okay, labaw na kung ma-expose mo sa OR niya, moingon ang doctor na give epinephrine 0.5, kidakit mga ganyan-ganyan. Tapos, wala man lang nimo gidilute. Okay? Wala nimo gidilute because these are potent medications. So nahatag nimo siya og bolus sa imuhang patient. Nag-shoot up ang BP sa imuhang patient, basi ka na pa ang mahimong rason ngano magka-CVA ang imong patient. Okay? Because there will be rupture of the blood vessels. Okay? So you really have to know, okay, unsa ang effect ani nga tambal. It will rise up the patient's blood pressure. Okay? To a certain extent na very high, extremely high. Okay? Kaya this should be given cautiously. Okay? So, sympathomimetic, by tawag ani ka ng theoretical description, this will mimic, okay? This will mimic or stimulate your adrenergic nervous system. Kaya yun siya na magka-pataas siya sa imuhang BP. Okay? Labaw na kung hypertensive pa jud ang imuhang patient. So, the therapeutic classification of this epinephrine falls under anti-anaphylactic. Ma'am, abi ba na ko papataas og BP ngano na ay anti-anaphylactic man siya? 'Di ba ang anti-anaphylactic is for allergy? Yes, it has the same function. It has that kind of function, okay? That they can relieve what? Signs of respiratory distress due to bronchospasm. Labaw na kapag naatay exposure sa ako ang kanang mga allergens. Oh, 'di ba pag magka-allergy ka, 'di ba maglisod ka ginhawa, there is bronchospasm. So, epinephrine is also given. But like what I have said, you have to check first your patient's blood pressure. Okay? And if there is really a need to give the medication, monitor your patient's blood pressure before, during, and after drug administration. Okay? It also acts as, yun nga, bronchodilator, a cardiac stimulant. Kaya nga siya ginagamit as pang-reverse ng ating, pang-reverse ng ating cardiac arrest, and as a vasopressor. Okay? Yes, pwede siya for anaphylaxis. Kasi nga, di ba, kapag nagkaroon tayo ng allergic exposure, ang nangyayari, di ba, nagkaka-DOB tayo. DOB, difficulty of breathing because of bronchospasm. So, binibigyan natin sila ng ating epinephrine para magkaroon ng muscle relaxation. Okay? And the effect of this medication depends on the dose that will be ordered by our attending physicians. Okay? Kapag bronchospasm, of course, okay, yung tawag pa lang yung acute na bronchospasm, okay? Babalik sa previous slide. Sorry. Okay? Kung acute na bronchospasm, mas minimal ang dose nimo. But if parehaan na CPR for cardiac arrest, bolus ang ginabigay natin. Okay? Bakit bolus? Because we want a rapid effect. So, the more potent the drug is, the faster ang effect. But, okay, mas cautious ang iyong administration. Yan. Kasi nga, syempre, this is very potent. Basi mag-shoot up po og sobra ang imuhang blood pressure, that will lead to rupture of certain blood vessels. Okay? Okay, sige. Shall we proceed? So, epinephrine, okay, epinephrine is a naturally occurring catecholamine medication, okay, which improves what? Perfusion of your heart and brain, especially during cardiac arrest. Kaya nga, di ba, pang-reverse yun siya. Because the effect of your epinephrine, okay, it will what? It will stimulate, okay? It will stimulate your heart and your brain, okay? And then, as well as, ang blood flow nimo is magiging what? Mag-compensate. Okay? Remember the compensation of our body in terms of crisis. So ito yung nangyayari. And i-administer pa nimo ang atong epinephrine. So nagkakaroon ng mas improved na na effect ang ating epinephrine sa ating mga patient. Ano ba ang component per se ng ating epinephrine? Remember that your epinephrine is an alpha adrenergic receptor. It has, it contains an alpha adrenergic receptor which can increase, okay? Which can increase or is capable of increasing what? Your myocardial and cerebral blood flow during CPR. Okay? Yun talaga ang nagiging ng epinephrine. Kaya pag CPR gani, always gid na nimo madungog tagaan og epinephrine. Ma'am, di ba pag CPR, ma'am, BLS kanang wala man na ma'am, naman jud ta kanang CPR, chest compression og kanang tawag ani mouth to mouth for ventilation. Yes, that is for BLS. But when you go on advanced nursing, ay dili lang po sure ha kung sa nursing karon na Okay, kay during my time, when I was still a student, wala man gud may ACLS. I had my ACLS when I was working already with LIMSO. Okay, so we were taught that during ACLS, ma'am, unsa nang ACLS, mura na siya BLS class, but there is drug incorporation or drug administration. Okay, na we nurses are trained how to perform intubation as well. Okay, pero class, before we can do that or before we can perform this procedure, we really have to undergo thorough trainings. Okay? Kay dili porke gitudluan ka karon og ACLS, pagkasunod hawd na ka, maghawod-hawod na ka na, oy dok padaplin dok di kay ako dok kay ACLS na ko train, dili ana. Okay? So, sa ACLS, okay, meron tayong ginatawag na mega code. Doon sa mega code natin, we are given a particular situation. Okay? Particular situation, tapos unsay buhaton, the nurse alone. Okay? The nurse alone will decide, okay, how much we will give epinephrine to our patient, ana-ana. Pero, yun nga, hindi yan siya dito sa atin practice sa atin sa Philippines. Nga naman, because we are still covered with tawag nito yung law na we are working under the supervision of doctors. Okay, sa Amerika wala may problema kanang advanced cardiac life support. Pero dire, we are taught to be trained, but still our function as nurses underlies the umbrella of our doctors. So our function, okay, will still based on what our doctor's order is. So kung ingon si doc na give 0.5 milligrams of epinephrine dilute in ganito na amount ng fluid. So yun ang susundin mo. Dili kay maghawod-hawod ta. Okay? So your epinephrine as well increases the chance of electrical countershock during ventricular fibrillation. Still on cardiac arrest. Okay? So what is the pharmacokinetics now of your epinephrine? Okay? Our epinephrine, majority of this, dili jud majority, but it is always administered intravenously. Kaya naka-indicate dito inactivated in the GI tract because no need na para sa oral. Kay walay oral form ani. IV gid siya. Okay? So rapid ang effect, onset 3 to 5 minutes from the time of administration. Peak in the plasma at 20 minutes, okay, from the time of administration. The duration, okay, the indwelling time of your epinephrine in the system will take 12 to 24 hours. Okay? Kaya bantayunon yun siya. Kay, nga naman, magpataka gani kag hatag og epinephrine, mao na gyud nang ginaingon dara nga mao na siya class nga number one problem gyud sa atong hospital is really the medication error. Okay, a lot of nurses kay kana pud laging kanang passive lang kaayo ba? Passive lang kaayo na. Kay ingon man ni doc, ingon ani, sometimes you have to verify. Though we are under the umbrella of our doctors. Okay? It does not mean that you will just be passive na Ingon man si Doc, hatag lang po ka. Dili man lang ka kay mo counter check. Tanawon sa nimo. Hala, nag-ano lagi si Doc, nag-order lagi si Doc og epi niya. Hypertensive man akong patient, uy. Huna-huna po sa siguro gamay no, tas tanawon nimo ang vital signs sa mong patient, correlate dayon ka. O, hala, ang BP ni patient kay ano man, 170 over 100, tagaag 80, ano man. So, tanawon po nimo, basi di ay nay allergic, unsa pay reason nga no nag-ano, and try to investigate ba, thorough na investigation, tanaw sa ka. Okay? And then if you are really suspecting that there is, dili man sa pataka ra si Doc. Okay? Okay, we are professionals man. We don't have the right na, uy Doc, pataka ka makaghatag og tambal, uy. Dili pod ana. Okay? We just need to verify. Doc, verify lang ko, Doc. Nag-order ka og epi, Doc. Ang ako ba yung patient karon, Doc, no? Kay ingon ani ang BP, Doc. Tapos, wala man po siya DOB, Doc. Ana-ana. So, remember, always look on our function that we are working as a collaborative. Okay? Walay pataasay og ihi diri nga. Doktor ko, ako ray hawd. Okay? Nurse ko, ACLS ko, kabalo ko ani. Dili. Wala, ingon ana. We are in a collaborative effort. So, what you are doing is just helping as well your doctor, okay, para sa ikaayos ng inyong patient. Okay? So, distribution, this is widely distributed and does not cross our BBB or our blood-brain barriers, but has the possibility to cross in the placenta. Kaya if your patient is, for example, pregnant, you really have to inform the patient, the doctor na, Doc, pregnant good si patient, Doc, tapos natay epinephrine. Wala ba na siya effect sa ato ang baby, Doc? Okay? So, of course, there is. Labaw na ko pag mag-cross sa placenta. But, yun na nga, kailangan siya bantayan. Pwede itawag din po ba sa pharmacist para mag-cross-check ng medication? Actually, yes, but ang pharmacist manggod natin class, okay, ang pharmacist natin, primarily, their function is to dispense the medicine. Okay? Dispense the medicine that is based on the order made by our attending physicians. So, if you are uncertain of those medications, before you go to the pharmacist, okay, direct muna tayo sa ating attending physician. Okay, Doc, verify lang ko, Doc, ba? Ngano to naghatag og ingon ani, Doc, sa ato ang patient, Doc? Look at the parameters. Okay? Deal first directly to the person under or closer to you before you go to the pharmacist. Sa pharmacist, usually ang ginapangutanan nato sa pharmacist, manggod availability of the drugs. Tawag nito yung mga drug-to-drug interactions kapag wala ba, lalo na kapag yung mga critically ill patients natin, okay, or yung mga merong mga renal failure na patient natin, ginatawag natin yan siya sa pharmacist na, Ma'am, unsa bay alternative nato na medicine sa ingon ani nga patient, Ma'am, ingon ana. Okay? But about sa prescription, okay, sa order of prescription, it is really, we really do the verification directly to our physicians. Okay? Okay na, Jazz? Okay. Sige. So, yun nga, it has the possibility or the capability of passing on our placenta. So we have to inform, okay, our attending physicians or our doctors that the patient is pregnant. Okay? And then the metabolized in your liver and it is excreted in the urine as well as in your breast milk. Okay? So epinephrine is really highly cautious to be administered or should not be administered. Okay? Should not be administered or it's contraindicated to women who are pregnant and lactating. Kasi nga, this could harm our fetus. Okay? So what are the adverse effects of our epinephrine? Okay? Epinephrine per se generally, okay, ang pag nag-administer ta sa to ang patient ani, unsay pinakauna nato ma-observe sa to ang patient, mag-complain atong patient og headache. Kasi nga, di ba, it will shoot up your blood pressure. Once there is already complaints of headache, bantayan na nimo imuhang patient ana. Okay? Kay basi magkaroon og rupture nga blood vessel. Okay? Unsa pa? Restless imong patient. Ngano siya magka-restless, ma'am? Because of increase in blood pressure. Of course. Pag restless siya, dili siya katulog. Okay? Tapos anxious kaayo perminti imuhang patient. Wala siya kabaluon sa gid iyang gibati. Okay? And naay signs of kanang tremors imong patient, kanang murag magkurug-kurug na gani siya. Okay. Mao jud na ang common na makita nimo pag ang patient is naga-receive og epinephrine. Okay? But systematically, okay, adverse reaction or side effects of epinephrine causes nausea and vomiting for digestive, for cardiovascular, palpitations, hypertensions na severely high, myocardial infarction, tachyarrhythmias, including ventricular fibrillation. Okay, labaw na kapag large doses na or kanang bolus na ang imong ginahatag sa imuhang patient. Kay usually manggod class kapag nag-asystole ang patient, okay? Ma'am, unsa nang asystole, ma'am? Kana kaning flatline, okay? Di ba sa ECG, kabalo ba mo anang ECG class? Siguro no. Di ba ang ECG nato kay di ba ana-ana man na siya, ang asystole ana ra na siya. Okay, flat. Ngayon, anong nangyayari sa ventricular fibrillation? Sa ventricular fibrillation, ang imong mga PQRS ana tag-as. Okay? Ana na siya. Okay? May nalang gani class no? As in murag kog nahulbutan og kanang tawag gani tunok sa kasing-kasing pag-ingon na dili na apilon ang cardiac arrhythmias kay murag huy Ginoo ko Lord, dili ko telemetry nurse. Okay? This kind of kanang mga ECG reading, okay, I know, okay, kabalo ko, mga sinus arrhythmias, mga ganyan-ganyan. Pero yung mga, ano na gani, yung mag-identify, makaingon na lang yung kung subuan na lang kog laing butang, ayaw lang ko pabasahag ECG. Oh. Kasi syempre, ECG reading takes a lot of what? Trainings. Okay? Because tan-awon lang na nimo dira sa tawag ani sa kanang sa monitor unsa nay dagan sa kanang rhythm sa imuhang heart. Unya kung maobitaw na ang mga telemetry nurse, abilan ninyo hayahay na sila kay sige rag atubang og computer no. Kana sa mga CCU, ana naman yung mga telemetry nurse, magsige lang atubang sa monitor, sige rag tan-aw sa monitor na naman tanan. ECG sa imong patient, vital signs sa imong patient na automatic na. Mudagan na lang ka inig tawag ani mag-arrest imong patient. Okay? Makita na nimo dira hala ana unya kung di ka kabalo mo basag ECG magunsa ka nga. O wa ka kabalo na imong pasyente nag-VTAC ta di ay. Okay? So kanang ventricular fibrillation, it happens kapag kapag na-revive na natin ang patient natin. Because ventricular fibrillation is the compensation of your heart to pump faster. Okay? So, for the respiration, tendencies of bronchial and pulmonary edema is possible for those patients who is receiving epinephrine. Okay? There is also possibility of urinary retention. Okay? And kapag ang patient natin, okay, long-term nag-receive ng mga epinephrine, okay, possibilities of having tissue necrosis is still possible. Okay? Pwede rin tayo magkaroon ng metabolic acidosis and elevated lactic acid ng mga serums. Okay? And then, itong altered perception and thoughts, okay, leading to psychosis, dahil na din ito yung sa severe headache, restlessness of your patient, your patient doesn't know anymore what she is actually feeling. Okay, as effect of the drugs. So what are the drug interactions? Okay, drug interactions. Ito na yung isa sa mga role na dapat natin i-correlate not only to our doctors, but specifically on our pharmacists. Okay, kasi sila yung mas well-versed pagdating sa mga ganito. Okay, so epinephrine should not be administered together with your phenothiazines, oxytocins, and entacaphones. Kasi nga, it will counteract the effect of your epinephrine. Remember that your epinephrine will increase your blood pressure. But if you're going to give it together with your epinephrine, these 3 medications, anong nangyayari? It will reverse or counteract its effect. Kaya mas nagkakaroon ng hypotension ang iyong patient. Okay? If you're going to combine epinephrine with other sympathomimetics, anong nangyayari? There will become additive toxicity. Kasi nga, ano ang ating sympathomimetic? They will increase your blood pressure. So kapag maghatag ka, ma'am, unsay example sa imuhang mga sympathomimetic medications, ma'am? Okay, example, pinaka-common, dobutamine, dopamine, which we will also be discussing after. Okay, after later on the lecture. Okay? Dopamine, dobutamine, norepinephrine, phenylephrine, pag ihatag na nimo together with your epinephrine, expect na lang yun ka na magkaroon ka og hypertensive crisis. Okay? And we don't want that to happen to our patients. Okay? We should not also give epinephrine together with our MAO inhibitors, as well as your tricyclic antidepressants, and alpha and beta adrenergic medications. Same lang with our phenothiazines. It will antagonize the effect of your epinephrine. Okay? So instead na mapaayos ang tawag-ani ang kanang blood supply, okay, sa brain and heart, okay, mas mawad-an noon og capacity ang imong brain og heart na makareceive og oxygenated blood. So useless lang. Maadto sa walay ma-waste lang ang imong epinephrine. Okay? Because dili ma-achieve ang ato ang expected or ato ang desired action sa atong epinephrine if you're going to combine it with these medications. Okay? And then if we are going to give epinephrine, okay, and your patient is in OR receiving general anesthesia, there is a possibility yun of cardiac irritability. Unya, ma'am, ngano mo hatag makag-epinephrine nga makakos na class, our medications are given, okay, if there is really a need na ihatag yun siya. Okay? Like the epinephrine, dili na maiwasan na maghatag yun epinephrine in OR. Pero we are really monitoring the patient. Na atay anesthesiologist, kumbaga sa OR man good class, kumpleto rekado na ka ba? Anesthesiologist, na kay kanang attending physician nimo, na surgeon, daghan kay kag nurse, unsa pa imong pangitaon. Okay? Talking about emergency meds, kumpleto na sa OR, tanan klaseng tambal. You can find it in OR. Okay? So, ang mga anesthesiologist na to, pag maghatag sila og epinephrine, kabalo na sila na there will be changes in the rhythm of your heart. Okay? Pero of course, they monitor it. So unsa na po ilang buhaton? Ila na po ipababa ang imuhang tawag-ani, ang imuhang blood pressure. They will regulate the IV, they will give kanang mga tawag-ani, mga beta blockers and unsa pamandira. So, ano na siya? Okay? They will do counteraction. And, ma'am, kung maghatag ang mga anesthesiologist o ingon ana, unsaon na nimo pag-chart, ma'am? Ngon ani. If the anesthesiologist is the one giving the medications, you don't have to chart it. Okay? You don't have to write it in the nurse's notes because it will appear on your anesthesia record. Unless, okay, the anesthesiologist will be the one to tell you, oh, Jan, pakihatagi ang patient og 2 cc na epinephrine. Dok, 2 cc? Kasi nga, di ba sabi ko, ginadilute siya. Okay, ginadilute siya natin sa normal saline. And sa OR, ang atong anesthesiologist ang nagamake sa cocktail sa mga tambal. Dili kita. Unless the anesthesiologist will ask us to do it. Okay, but most of the time, it is the anesthesiologist. Okay, so sige, bigyan mo ng ganito, ganyan. Yun, dahil ikaw ang nagbigay as the nurse, yun yung isusulat mo sa iyong nurse's notes. Na 230, given, administered 2 ml 2 ml of epinephrine IVTT as ordered by Dr. ganito. So, ganun siya. Okay? Tapos, dili na nimo ibutang sa imong medication sheet. Dito lang sa chart. Okay? Okay, 'di ba sa medication sheet nato ang ibutang lang nato dito is ang mga standing order. Okay? But that one that is an intraoperative order. Okay, that's an intraoperative order and the anesthesiologist was only asking help. Okay? No need for you to write it on that doctor's order or sa doctor's order sa imong medication sheet. But if you are the one who gave it, it should reflect on your nurse's notes. Okay, that's why sometimes you really have to take note about the medicines that you are giving your patients. Okay? So, what are your nursing actions for a patient or for a patient who is receiving epinephrine? Okay? Number 1 is you really have to monitor your patient's cardiac and hemodynamic status. Okay? Kasi nga, okay, ano itong cardiac and hemodynamic status natin? This includes your vital signs, including your urinary retention. Kasi nga, your epinephrine has the ability to cause urinary retention. Okay? And observe closely your patient during IV administration, the drug. Okay? Kasi nga, your epinephrine can cause or can contribute to widen your pulse pressure. So, magtaas ang imuhang blood pressure, magtaas pod ang imong pulse rate. Okay? And then, maliban pa ana, magkaroon og irritability ang imuhang cardiac rhythm. So, monitor gyud imuhang patient. Again, before, during, and after drug administration. Okay? Next is use extreme caution, okay, when calculating and preparing doses of your epinephrine. Okay, remember, put in mind that this is a very potent drug and even a small error, not only with epinephrine, but all forms of medication, whether you have given it intravenously, intradermal, intramuscular, sublingual, or kung asa pa na, or oral ba na, be very vigilant. Okay? With what? Drug administration. Bantayanan yun na imo. Okay? Maskin pag-asa ang ruta, ana, once you ingest it, once the patient ingests it, you can cause harm to your patient. Okay? So, unsaon ka mahimong effective nurse kung ang imuhang buhaton is to cause harm to your patient. Okay? So, usually class, okay? Usually, when we do sa ako sa OR, okay, what we do is pag kami circulating or pag ako circulating, naanami standby na epinephrine. Okay, standby epinephrine din na mo siya, and then it has label on the syringe. Okay, naka-indicate na dira, okay, naka-indicate na dira na unsa ang dilution namo. 1 ampule of epinephrine is to what? 9 ml of normal saline. Okay? So that is 1:1,000 solution. Okay? Mauna siya. Mauna ang among practice, ha? Okay? Wala ko kabalo sa uban kay institutionalized ta, kanya-kanya taog ka ng preparation, ana. Kumbaga, tinudluan na to sa amuang chief anesthesiologist. Okay? Kasi nga, at emergency, dili namin magsigig-dilute. Okay? Ma'am, pag na-dilute na nimo sa kaninga patient, pwede pa na nimo gamiton sa sunod? No. 1 patient, 1 preparation. Ngon ana mo ginagbuhat. Okay? Unsa mo ang gina-prepare ana kapag kasi sa amua sa sa limsog, understaff man jud ni. Diri sa Pilipinas common jud nang word na understaff. Okay? Naliman kag sa isa ka shift, pila ra mi kabuok ka nurse na tawag ani ka ng staff nurse. 3 o 4 ra mi kabuok, unya pila kabuok among pasyente sa buntag. Apil na dira sa 4 ang among head nurse. Unsaon na amo pag tawag ani? Unsaon na amo pag cater sa tanan elective surgeries kung ingon ana among staffing unya dili mi mag-prepare ahead of time. So pag abot pa lang namo ana kabalo nami kani elective cases na to karon ingon ani. So kabalo nami unsa mong ipam-prepare. Okay? Dili sa na namo abrihan ang medication. Dili sa na namo i-prepare. I-prepare lang nga namo ang mga medicines pag naa na ang patient sa sulod sa OR. Okay? Pero pag wala pagani dili na namo kinahilabtan. Okay, kay syempre gamay kibutra nimo sa OR, charge na sa patient. Ultimo ang kanang gos nga isa ka buok nga imong inabrihan, i-charge na nimo sa imong pasyente. Kaysa naman ma-charge sa imong sweldo, dili ka. Diba? So ana na siya. So dapat ano pod ta? Patient advocate pod ta na dapat dili ta magpataka-taka lang og pangabri. Okay? So yon. Continue. So we have to make sure to protect our medication, the epinephrine, from direct light and extreme heat and freezing. Nga naman, because this will destroy the potency of your drug. Kailangan room temperature lang talaga siya. Okay? Keep a rapid-acting alpha-adrenergic blocker. Example is your phentolamine or a vasodilator, a nitrate to be specific. Kato mga nitroglycerins na to. Readily available in cases of hypertensive reaction. Kasi nga, di ba, kapag meron tayong epinephrine, okay, possibility of cardiac irritability is very high. Not to be administered in the same site who is having an ongoing infusion of alkaline solution. Nga naman, because alkaline solution such as your sodium bicarbonate can deactivate your epinephrine. So it will be put into waste ang imuhang epinephrine kapag imong ihalo with an alkaline solution. Okay? So possibility of presence of metabolic and respiratory acidosis decreases the effect as well of your epinephrine. So kung kabalo ka na ang imuhang patient na ay metabolic acidosis, magduha-duha na ka. Ma'am, paunsaon ako mabalaan ang ang patient na ko na metabolic acidosis. Makita na nimo siya class sa imuhang blood. Okay, mga pH, partial carbon, partial and later on you will know about that. I'm not sure if it's already discussed to you at this time, but I'm pretty sure on your third year naagit na siya. Okay, dira nimo mabalaan kung compensating metabolic acidosis, metabolic alkalosis, ingon ana. Okay? So another form, okay, that is all about epinephrine. Okay. We'll go now to our next kind of emergency drug. Okay? Kung kaganina ang epinephrine, pinakauna, ang atropine ang iyahang katapad. Mauna, bantayan yun na imo siya class na naman. Ang epinephrine o atropine, usahay parehas og dagway. Okay? May ang uban pa naman no kay ang labeling nila naka-embed sa or naka-print sa ampule. Ang uban pod ingon ani na naay sticker. Pero kanang labaw na kung sa government hospital ka, ang ilahang mga labels is printed sa ampule. Okay? Muna unya parehas og dagway na ingon ani brown o color. Muna maglisod usahay pagka na kaning emergency, balipat-lipat ka kung unsa imong gikuha epinephrine ba or atropine. Muna bantayanan gyud nimo. Okay? So our atropine, okay, this is a group of medicine known as anticholinergics. Okay? And what? Your anticholinergic medication are transmitter for acetylcholine in your central and peripheral nervous system. Okay? So, unsa ang ginabuhat sa atong atropine, ma'am? Okay. Para dili mo maglibog, unsa ang pinaka-function sa atropine, ginahatag ni nato to our patients who are experiencing bradycardia. Okay? We give this to our patients who are having bradycardia. Okay? Ngano man, ma'am. Okay? Ngano man. Okay? Before that, okay? It falls under the therapeutic classification as anti-arrhythmic medication and anti-muscarinic. Muscarinic na medication. Okay? And usually, sa OR, ngano na perminti na ko ma-correlate ang OR or ngano na ko ma-brought out. Not because I'm an OR nurse, but these medications are really common in OR. OR ICU gyud ni siya. Okay? As in daghan gaapaw-apaw gyud ni dito sa sulod sa OR. Okay? So, ginahatag ni nato siya for our patients prior, okay, receiving general anesthesia. Ngano man, ma'am? Because iyahang isuppress ang production of what? Saliva and mucus sa ato ang lawas. Okay? Kasi syempre kapag na-anesthetize ka, 'di ba? Wala namang kay ability to swallow. Okay? Syempre ikaw daw ma-anesthesiahan daw ka, di ba ka matulog. Okay? So we are giving this to reverse what? Kanang para dili magkaroon og possibility of kanang aspiration ng imong patient. So, iyahang i-block ang production sa saliva. Okay, maliban pa ana, okay, atropine sulfate, ginahatag pod nato na siya in addition to our what? Kanang pampa-reverse sa general anesthesia brought about by muscle relaxant. Ma'am, wala ko kasabot, ma'am. Okay. If your patient is receiving general anesthesia for a long time, okay? Syempre, dili lang man kay isa ka tambal ang ginahatag sa mong patient. Dili lang isa ka muscle relaxant. Ma'am, ano ka nagahatag og muscle relaxant? Of course, class, you are doing operation, okay? Compensation sa tong lawas inikabrihan na imo class manggahi na. Okay? Your muscles will constrict. So if your muscles are constricted, okay, as a normal effect or function of our body, makaopera ka ha ang doktor, makitaan ka ha sa doktor unsa iyang gipangita kung na ba siya, kung labaw na kung nag-exlap siya, makitaan ka ha na sa imong doktor ang mga bituka ang kinaay or kung asa man ang may perforation. Of course, no. Kasi it's constricted. So, kailangan i-relax ang muscle, i-relax ang buong katawan. Okay? Not only the organs, but including the brain and your heart. Gina-relax na nato. Gina-parelax na nato. But, okay, naatay ka ng monitoring. Siyempre, kung matotally relax yung heart o brain, natigok na ka. O, di ba? That is the work of our anesthesiologists. To monitor and to what? To calculate the dose of medications the patient is receiving. Okay? So, karon, sa kadugay niya nagdawat og muscle relaxant o general anesthesia, niya pahumanay na ang operation. Dapat mabalik na sa sensation or mabalik na sa wischo ang imong patient. Unsay ginabuhat sa tong anesthesiologist? They are giving our patients reversal. What is this reversal, ma'am? Reversal is a combination of atropine sulfate, neostigmine, and hindi naman every surgery. Usually, ginabigay natin ang ating atropine sulfate prior to surgery kapag general anesthesia. Tapos, long-term ang operation. Okay? Kasi nga, pipigilan natin yung production ng saliva para hindi magkaroon ng aspiration ang ating patient. Yun siya. Okay? But not all surgeries will receive, magbigay tayo ng atropine. Magbigay tayo ng atropine, okay, primarily kapag sa OR, kung nagka-bradycardia ang inyong patient. Yan, magbibigay ka ng atropine. Kasi yun yung pinaka-effect niya. Okay? Pero hindi siya mandatory na. Lahat ng patients papasok ng OR may atropine sulfate. No, it's case-to-case basis. But if your patient is known to receive, ma'am, paunsa na mo mabalaan na mag-receive siya of GA? Because class, okay, we do pre-operative rounds. And before and all of that, you will know next when you go to third year. Okay, when you will be having your surgery concept, which I am also teaching. Okay? So, yun siya. Okay? So, pag spinal, pinaghan man ng klaseng anesthesia, na spinal, na GA, na epidural, Kung spinal, hindi na necessary magbigay ng atropine unless there is bradycardia. But for GA, we are really giving atropine para hindi lang magkaroon ng overproduction of saliva ang patient. Okay? So, yun nga, yung reversal, a combination of atropine sulfate, neostigmine, and sterile water or normal saline solution. Yan ang ginabigay natin para mo counteract sa effects ng muscle relaxants. Okay? So atropine sulfate is indicated for the treatment of significant bradycardia and some types of heart block. Okay, it increases the rate by inhibiting the action of your vagus nerve in your parasympathetic effects. Okay, so yun ang ginagawa ng, or yun talaga ang actions ng ating epinephrine, atropine sulfate. So pharmacokinetics, okay, it is absorbed after intramuscular administration. Ma'am, naani siya IM? Yes, sometimes you are giving IM, but of course, kung gusto natin ng direct effect, we are giving it intramuscular. Okay? And the usual good na practice natin when we are giving atropine sulfate, we give it intravenous. Okay? We don't give it intramuscular. Okay? This is metabolized by your enzymatic hydrolysis present in your liver. This is excreted in the urine as well as in the breast milk. So almost the same with your epinephrine, diba? So this is what contraindicated for lactating and kanang mga pregnant women. Okay, crosses the placental barrier and may enter fetal circulation. Okay, basi mag tachycardia ang imuhang fetus. Okay. So what are your nursing responsibilities now? Okay, so dalawa lang ang giano ko dito. Dalawa ang binigyan ko ng emphasis. Okay? Paano magbigay ng ng atropine sulfate? Kapag bradycardia, okay? If your patient is experiencing bradycardia, ma'am, unsa gani ng bradycardia, ma'am? Okay? Plus, bradycardia man ng 59, 58, but there's no need for atropine. Okay? Dili nimo kailangan maghatag og atropine. Check lang usa nimo ang pulse oxy. Okay, check usa nimo ang pulse oxy kay basi nahiwi lang maunag bradycardia imong patient. Tapos maliban pa ana, encourage your patient to deep breathe. Okay, kung coherent man lang ang imong patient. Deep breathing. Okay, kay basi kanang nagluya lang ang imong patient kay minghoy man kaayo niya akong nurse pagid kay wa pa jud kalatoy-latoy kay akong nurse nagsige ra magtan-aw nagtutukanay na lang man yung mukha. O ana, basi naluya ra imong patient, kailangan lang iyag stimulation. Okay, kailangan unsa man magtambling-tambling ko sa tubangan sa patient, dili pod. Okay, once you are there in your patient, okay, if your patient is capable of talking, okay, kana bitaw sa ICU na may uban pasyente ana dira class nga dili nakatubo for close monitoring lang. Diba mo istorya man na sila niya, kitsa man nilang istoryahon sa ICU nga ang inikilit niya puros nakatubo. Syempre ang nurse, diba? So istorya po yung mga pasyente pa nagsa. Ma'am, kumusta man kadira, ma'am? And because even small talks can help boost your patient's what? Kanang moral. Okay? So, mura pod na good sa atua, di ba? Mas maka-feel ta og kanang importance if we know someone is cheering us up. Okay? So, yon. So, for bradycardia, okay, usually, bradycardia na kanang 55, 56 na, okay, kita ka, hala, bradycardic na, consistent na, okay, ingon na dayon kasi mong doktor, Dok, bradycardic na gulo kong patient, Dok, ako ang Dok, ako ang pulse rate, Dok, ingon ani sa monitor, tapos nag-counter check ko, Dok, ingon ani gihapon, baba siya. Okay, moingon si Doc, sige ma'am, taga-ilang og kanang ma'am, kanang atropine sulfate, ma'am. Okay, so unsa ang ginabuhat namo sa atropine? We are diluting it. Okay, just like your epinephrine. We are diluting it with what? Samua sa limso. Okay? Siyempre, dito lang dyan ko mo base kay wala man ko kabalo sa laing hospital, no? Okay, and then ako ang exposure sa Saudi, wala man ko function as kanang lahi man gud ang scrub nurse o circulating nurse sa anesthesia nurse. Naman jud may anesthesia nurse sa Saudi. So we are not dwelling with the medicines. Amua lang yun is scrubbing, circulating, maura gud na ang amua. But here in the LIMSO, all around man me. So we are preparing the medicines, we are doing the circulation, charting, tapos kami po mag-prepare sa meds, kami pa mutabang extubate, intubate, tanan. Okay, all around. Okay, and that is really common not only in LIMSO but here in the Philippines. Okay, so na among ginabuhat is 1 ampule, okay, 1 milligram or 1 ampule of your atropine sulfate. We dilute it with 4 ml of what? 4 ml of normal saline solution or sterile water for injection. Okay? And then, yun na ang ginabigay namin sa aming patient. Kapag kapag naga-bradycardia na ang aming patient. Okay? Tapos, range of 0.5 milligram. Ang isa ka ampule, okay, ang isa ka ampule, nagibutang nimo dito sa tawag ani sa isa ka syringe that is already considered 1 gram. Okay? So, it should be given 3 to 5 minutes interval until the desired heart rate is achieved. Kunyari, nag-62 na ang imuhang heart rate, consistent na. So, pwede na nimo i-withhold ang imuhang atropine sulfate. Okay? But, in cases of asystole, or ingon ani, flat line, and during emergency, unsay ginabuhat, okay, wala na'y dilution. We are giving it direct IV bolus. Ang 1 ml, diretso hatag sa IV. Okay, tapos flush dayon og 20 ml na IV fluid, whether it is saline or it is D5 water. Okay? Maugin na ang ato ang ginahatag sa atong patient. But in cases yun, pansinag yun na ninyo, if you have your opportunity, unsa ang fluid na ginagamit pag-arrest, saline ra gyud na siya. Okay? So, mao na. Okay? So, for adult doses, okay, we are not giving less than 0.5 milligrams of atropine. Why? Because the patient might have paradoxical bradycardia. Ma'am, unsa ning paradoxical bradycardia? It is still a form of what? It is still a form of bradycardia. Pero, okay, unsa lang ang mas niya is kanang slow ang beating sa heart. Diba? Usually, ang beating sa to ang heart is lab-dab, lab-dab, lab-dab. Diba, ana? Ang sa paradoxical bradycardia kay mura siya glucose, lab-dab, lab-dab, lab-dab. Okay? Ingon ana lang. Okay? Dili siya continuous na lab-dab, lab-dab, lab-dab. Oh. Okay? So, that is your paradoxical bradycardia. Okay? Our atropine sulfate could be given IVTT or through endotracheal tube. Hala ka ma'am, endotracheal tube, dili ba mag-aspirate imong patient? No, dili mampod nimo ibolus og hatag class. Ginagmay lang mampod, labaw na kung wala kay access line. Kay syempre class kapag kana ganing emergency, mangbuto baya gyud ang kanang mga ugat sa imuhang pasyente. Okay? Dili maskin pag unsa ka kahawd, labaw na kung dehydrated pa jud imong patient, expect na lang you kana you will really have hard time na magkaroon og access line for your intravenous fluids. Okay? Mag-cut down pa, dugay pa kayo ng cut down. Okay? So, ang ginabuhat usahay is ginaagi through your endotracheal tube. I personally, wala pa ko katry og EPT. Okay? Wala pa ko katry na naghihatag sa endotracheal tube. So, also monitor your patient's what? Cardiac and blood pressure monitoring is really essential. Okay, kay basi pod nasubrahan na pod. Basi tawag ani nagtakikardia na pod ang imong pasyente kay nasubrahan na pod imong kinatag og atropine sulfate. Okay? Tapos monitor pod nimo ang blood pressure niyo. Just the same with your epinephrine. Okay? Next. So, this is now another kind of medication. Okay, emergency meds that we are experiencing. This is another kind of sympathomimetic medication. Ito yung kanina na hindi dapat atin i-combine together with our epinephrine. Okay, this is your dopamine hydrochloride. Okay, dopamine falls under the classification of adrenergic medication and has effects as vasopressor, okay, catecholamines, as well as inotropic medications or inotropic drugs. Okay, so our dopamine is a natural catecholamine. Okay, so it improves the hemodynamic status of your patient, especially if your patient is experiencing shock due to what? Reduce or mababa ang cardiac output. Okay, we are giving this para mag-compensate, mag-stimulate, mag-compensate para mas mag-increase ang imuhang cardiac output. Okay, so this is usually given, okay, for severe heart failure patients and patients who are experiencing cardiogenic shock. Ma'am, unsa ng cardiogenic shock? Cardiogenic shock is just the same with your cardiac shock. Cardiac shock, okay, your heart is not anymore capable of pumping, okay, enough blood supply to your what? Blood supply that contains oxygen to your organs, okay, as well as to your brain. Okay, yun yung tinatawag natin na cardiac shock. Okay, so what is this indicated or how is this indicated? Okay, this is indicated for the correction of your hemodynamic imbalances. Okay, present during shock syndrome due to MI, trauma, endotoxic septicemia. Okay, patients who underwent open heart surgery, yung CABG, okay, renal failure, as well as chronic cardiac and decompensation in your congestive failure. Okay, so your dopamine is also used to treat for hypotension and severe bradycardia. Okay? Kasi nga, it will enhance the contractility of your myocardium kapag nagabigay tayo ng dopamine. Grabe ka, alimuot ba? Promise, alimuot kayo sa mong balay. Hindi ka ulan nun. Okay? So, yun yung purpose or yun ang function ng ating dopamine. Okay? So, pharmacodynamics now of your dopamine. Okay? Dopamine, the onset of action occurs within 5 minutes after drug administration. Okay? And unlike with your epinephrine and with your atropine sulfate, ang dopamine, dili ni nato ginahatag sa syringe. Asa di ay na siya ihatag? Ma'am, ipatingal sa pasyente? No. You are going to give this intravenously through your burette. Ano na to ni siya? Dili siya side drip, kundi piggyback. Okay? Na ang uban gani sa mo ang practice na mo ani sa tawag ani sa ICU. Okay? Sa ICU sa Limso kay separate gyud siya na IV line ang ato ang dopamine. Okay? So naga-double line sila pag nasa ICU. Isa ka main line o isa ka dopamine. Okay? Kay sa main line ang uban niya ng mga medications, ang PCAS is pang dopamine use lang yun siya or Dobio. Okay? So asan ako banda? Okay. So the duration of the action is less than 10 minutes. Okay? Pas-pas. Okay? And dopamine effects are dosage dependent. Okay? So ang effect sa imuhang dopamine mag-base gihapon sa kung unsa kadako ang volume sa imuhang gihatag na medication sa patient. If it is less than 5 microgram per kilogram per minute, okay, it functions as what? Okay, it will only activate your dopamine D1 and D2 receptors in your kidneys, in the mesenteric and coronary vascular rate, causing vasodilation. Okay, murag relaxation ang purpose. Okay? For patients who are receiving 5 to 10 microgram per kilogram per minute, Okay, your dopamine now will activate your beta-1 receptor, enhancing your heart rate and contractility. So this is what we use to our patients who are experiencing what? Hypotension, bradycardia na severe. But if your patient is receiving more than 10 microgram per kilogram per minute, okay, it will activate your alpha-1 receptor, causing vasoconstriction and increase in blood pressure. Ito na yung kapag nakaresuscitate na tayo from CPR. Okay? Ito na yung ginabigay natin. Okay? Pag CPR, epinephrine pa dito, epinephrine fluids, ana-ana. Pag na-resuscitate na itong patient, mo-order tayo na ang doktor o give dopamine, ingon-ana. Maujud na siya ang sequence. Okay? So take note of this class. Okay? So what is the pharmacokinetics now of your dopamine hydrochloride? Okay? Ay, wait lang po, babalik. Sorry. Balik. Okay. Sige. Go, Shan. No worries. Sige lang, ingna lang kung paspas ka ayo. Actually, gusto ninyo mag-break, tagaan sa tamog break. Kahit ano lang, 45, 15 minutes. Okay, at 4 o'clock we will resume. Okay? Sige, nakopya. Ito na lang ang last natin, ha? Break sa ta. Yung murag nagsakit na ako ang tilaok o kung istorya. Okay na to, Shan?
Okay na, ma'am.
Okay, sige. Stop share ko muna, ha? Okay, you can take your break muna. Okay, class. If you are still eating, just continue eating. I will just continue the lecture. Okay, just listen. Okay. Okay, so this is where we have stopped. Okay. Sige, ikaon lang ko sa inyuhang mga ano ha, sa inyuhang mga tawag ani, sa inyuhang mga snacks. Unta sa inyuhang kinit-it, sa inyuhang mga biskwit o unsa ba dira, apila po po ninyo po na ma'am, para ni sa imo, ma'am. Okay, para di mo matukan, charot lang. Okay, sige. Actually, nag-check man ko sa inyuhang quiz sa Quaper, and thank God, ay, wala na, kita na noon, expose. Okay, thank God, at least makabawi-bawi man lang mo sa inyong quiz. Okay, makabawi-bawi man lang mo sa inyong quiz na makatabang para sa inyong grades. Okay, so mauna lang yun din siya actually akong ginahulat para matag na nako ang inyong midterm grade. Okay, so let's continue. So this is now the pharmacokinetics of your dopamine. Okay, so it is widely distributed in the body and does not cross your BBB to a significant extent. But still, okay, if we are kasi ito, especially this dopamine, okay, this is really common sa mga ICU patients. Okay? Kapag kabalo na gani sila na pregnant ang patient, tapos maghatag og dopamine, okay, they try to regulate the dose. Okay? Kasi nga, though wala pa siya significant studies that there is really effect on the neonate or in the fetus, okay, they just make sure na talagang wala siyang magiging adverse reaction. Okay? Kasi baka pwede siya basi pag larger or higher ang dose, na tendencies of uterine contraction. So, dili po na to siya pwede So, in minimal doses lang. Okay? So, this is metabolized 70% in your liver. Okay? And then 25% of this is metabolized to your norepinephrine and the adrenergic terminals in your brain. Okay, and this is excreted, okay, in your kidneys, okay, and it will be expelled within 24 hours, okay, from the time of administration. So what are the medications that are not supposed to be incorporated or given together with your dopamine? Okay. Example is halogenated anesthetics. So, mga gas na anesthetic agents. Common na ginagamit natin ngayon at present time is your isoflurane and sevoflurane. Okay, etong desflurane and enflurane wala pa ko katry, but these are actually just brands. Okay, iso and sevo lang ako. Okay, nga na dili siya pwede i-combine, ma'am. Okay, what if ma'am ang patient nato is kanang nag-CBA, tapos kailangan mag-undergo o kanang tawag ani kanang craniotomy, nag-receive siya og dopamine prior. So pag ang patient is known to have is subject for possible operation, i-withhold na gyud ng tawag ani, i-withhold na gyud ang dopamine at least 2 weeks before the operation. Ngano man, kasi nga there will be negative effects if you combine your dopamine with your gas anesthetics. Anong nangyayari? Okay, what happens is it will lead to your ventricular arrhythmias and hypertension. Pwede ka magkaroon og cardiac arrest sa table, which is a big no-no. Ngano man, kasi class, pag naay namatian sa OR, okay, kunyari na nag-arrest sa OR, wala na resuscitate, pwede ma-close ang hospital. Okay, and I'm not sure if the entire hospital, but the OR will be closed. Okay, i-subject yun na siya for closure and dili na siya pwede mag-function. Mao na siya. Kaya wala joy ka ng mortality sa OR. Okay? And then, it is not what? Kaya pag ano yun, pagkabalo na na, pagkabalo na ang mga doctors na kani kay for OR gyud ni kay nay blood clot ngon ana sa brain. Tas naga-receive siya dopamine. So, ang buhaton na nila ila na nang stop long before pa, weeks before the surgery. Okay? Para dili magkaroon og effect sa patient. And then, nganuman pod, unsa di ay ang mabuhat pag ihalo sila ma'am, pwede ka mag-cause of cardiac rhythm na tawag ani kanang irritability. And then, monitor yun. Dapat perminti ang imuhang cardiac rhythm pag naga-receive og dopamine pod ang imuhang patient. Okay? So, dopamine should not be given together with your MAO inhibitors such as your carbosazid. Okay? Phenelzine, tranylcypromine, okay? Actually, dili kay ko familiar ani ng mga medications. Okay? So, kani siya ang mga example sa mga MAO inhibitors na dili nato pwede i-combine or in general dili gid nato pwede combine ang MAO inhibitor sa ato ang mga dopamine. Ngano man kasi okay, pwede siya makaprolong or makapotentiate og what? Severe hypertension to your patient, and then pwede pod magkaroon og cardiac arrhythmia ang imong patient pag imuhang i-combine ang MAO inhibitors og dopamine. Okay? Your tricyclic antidepressants. Okay? You are not allowed to give it together with your dopamine. Okay? Kasi nga, this may potentiate what? Cardiovascular effects. Sample, hypertension. Dili lang ordinary hypertension, but hypertension crisis. Okay? Kaya monitor gihapon dapat imo ang blood pressure sa imong patient. Okay? So vasopressors such as epinephrine and oxytocin. Apil pa ang oxytocin, ma'am, na pampakontract sa imuhang uterus during pregnancy. Yes, they are not suitable to be given or combined together because your vasopressins or your vasopressors may what? Contribute, okay? Or may alleviate the possibility of having severe hypertension, okay, to your patient. And for patients who are pregnant, pwede ka mag-cause of maternal hypertension because of combining dopamine together with your oxytocin. Okay, so kaning upat, dili gid ni nato ina-combine with our dobutamine. So what are your nursing actions? Okay, so the lowest dose, okay, for administration of our dopamine is from 2 to 20 microgram per kilogram per minute. Okay? Maugid na siya ang kumaga safe dose natin. Ano ba ang use nitong ating mga dosing? Okay? If your doctor is ordering, okay, ordering dobutamine at tawag nito at range. Okay, the range of, let's say, 5 to 10. Okay, if it's 5 to 10, okay, 5 to 10 mcg per kilogram per minute, this is what? Increases cardiac output and renal blood flow. Okay, increase cardiac output and renal flow. Okay? Or tawag nito, this is what we call also as inotropic dose. Okay? Inotropic dose. 5 to 10. Okay? Inotropic dose is 5 to 10 microgram per kilogram per minute. Per minute. And then ang effect niya increases cardiac output and renal flow. What about if your patient is receiving 10 to 20? If it's 10 to 20, eto na yung higher dose natin. Okay, anong nangyayari sa higher dose? It will now cause vasoconstriction. Okay, vasoconstriction. Okay? And pwede magkaroon ng pwede magkaroon din ng effects such as reducing, decrease in your what? Renal perfusion. Okay? Yan ang nagagawa ng dose na 10 to 20. Vasoconstriction and may reduce as well renal perfusion. Okay? So, okay. Kapag naman more than 20, anong nangyayari? There will be increase in blood pressure stimulating now your what? Vasoconstriction. Increase blood pressure and stimulate vasoconstriction and may not have beneficial effects on your blood pressure. Kasi nga, kapag mataas na ang dose ng inyong dopamine, pwede siya mag-cause ng tachyarrhythmias. Pag mag-tachyarrhythmias, mauna ng mga VTAC, mga VFib, mga ganyan. So when we are giving our dopamine, we give our dopamine via what? This is your infusion pump. We give it in infusion pump and then we put the dose of your dopamine in your calibrated what? Calibrated cylinder or your what? Your burette. Yung ganyan yan siya. Ambot po nakakita na mo ani tas naana siya calibration dira ana tas naana siya murag bola dira sa sulod. Tapos kanina ana siya katong murag chamber nga na ay same sa IV fluid tapos ilahan ang i-attach dire ana. Tapos kanina apod na siya spike dira kanang iyang spike that is attached to the IV fluid. Magkunyari 50 ml lang ang ipa-prepare sa imuha. So 50 ml imong ibutang dire sa dapat sa imuhang burette. Combined na sa dopamine o sa IV fluid. And I will teach you the computation. So mao ni siya ang atoang kailangan kapag mag-transfuse ka og dopamine. We will be needing your what? Your infusion pump as well as your burette. So it should be weaned gradually. Kasi nga pwede magkaroon ng hypotension. Severe hypotension kapag bigla mong i-stop ang pag-administer ng dobutamine sa imong patient. So just like your other emergency drugs, your epi and atropine, we should not give your dopamine together with your sodium bicarb kasi it will inactivate the alkaline solution of your dopamine. And continuous heart rate and blood pressure monitoring should be what? Should be performed during patient receiving this dopamine solution. So if your patient is already receiving dopamine, ano ang kailangan natin? Isa-alang-alang. Check your IV sites regularly. Kasi nga, this will what? Produce tissue necrosis. May lang untag ka ng simple extravasation lang. What if niabot sa point na na-burn? As in, totally na-damage ang tissue sa mga patient. Mag-perform pa mo og skin grafting. Kaluoy sa patient. Because of the nurse's negligence of not checking the IV site regularly. So, ano din ang ginagawa natin? Aside from IV site na gina-check natin, we are giving what? This medication. Unsa ni? This is phentolamine or ang brand name niya is Regitin. Okay? This is given, okay, sa patient, still intravenous, okay? And it is diluted to 10 to 15 ml of normal saline. That is to prevent tissue damage on the surface area of the IV site. Okay? Take note of that. Phentolamine or Regitin is the brand name. Okay, sorry. So, let's continue. So, that is all about our dopamine. Okay? So, now we will go to the computation. Okay? So, this is really useful not only today, but until you will become future nurses. And mind you, class, during my board exam, nang gawas gud ni, kay kanigid siya. So, please, I hope kaning ako ang kay during my time when I was still on my college days, wala gid mi kitudloan an. Okay? I only knew how to compute for this katong staff nurse na ang nagtudlo sa amoa. Okay? But my clinical instructor, mga mangtas man to, wa jud mi kitudloan. Okay? Magsigilag pa drug study. Oh, ato. Mo na nga katong na-encounter ni pagkaano na ako na ala na anapuy ka ng dubyo og dopa, so dapat gyud anak ko na dapat jud ang ako ang mga estudyante kabaluan ni kay para dili sila maulawan. Okay, so here are the formulas as to how you are going to compute for your dopamine. Okay, first is if you are being asked how much is needed. Okay, how much of the medication is needed if you are asked for a 50 ml solution? Diba? Sabi ko nga, our dopamine is administered through infusion pump and then we are using the burette. Okay? Doon sa burette na yan, okay, doon sa burette na yan, doon natin ilalagay ang what? Ang infusion preparation. Doon, teka ha. Okay, di ba sa burette? Okay. Ingno na to, ang amount needed nimo is what? Ang order sa imo sa doktor is 50 ml. Di ba? 50 ml of dopamine. Dopamine. Ngayon, kailangan nimo mag-prepare. So, pag compute nimo, ang infusion preparation nimo kailangan imuhang IV fluid. Ang IV fluid lang na pwede, D5 water, normal saline solution, D5 LR, okay? Ganito, plain LR. Okay, but ang usual na ginagamit natin NSS at saka D5 water yun. Morning pwede. Okay, na panghalo sa atuang dopamine. Now, first and foremost, you have to identify first, okay? You have to identify first the amount needed. Okay? How? By computing, okay? By knowing the patient's weight and multiply it by 3. And 3 is constant. Okay? This is constant, ang 3. So, if your patient is in pounds, what are you going to do? Convert it to kilograms. Okay? Convert pounds to kilograms. Patient's body weight times 3. Ang result niyan is you will be getting the drug needed for the solution. Okay? Whether it is 50 ml or it is 100 ml. Okay? Next, for the infusion preparation, the needed dose in milligram. Needed dose, eto yun, di ba? Kunyari dito is 150. Oh, kay ayun na itong sulat. Okay, the patient's weight, kunyari, is 50 kilograms. Okay, multiply by 3, this is 150 milligrams. Understood? I hope you're following. The infusion property or infusion preparation, the needed dose in milligram, that is 150 milligrams. Okay, 150 milligrams times, kunyari sa problem na hinihingi ay na binigay sa inyo, ang preparation is or the available preparation of your dopamine is 200 milligram per 5 ml. This is the available stock. Okay, so 5 ml over 200 milligrams equals pila. Okay? So pila to siya. Yan na mag-compute sa si ma'am. Kaya din how to math si ma'am. Okay? So we multiply 150 times 5 divided by 200 is 3.75. Okay? Na i-answer. Pag math ganit, tabangin ninyo si ma'am. Uy, kabalo ba yung lisod kayo ng math? Kalaban ni sa math ba? 3.75. Okay, thank you, Jill. Thank you, May. Okay, so that is 3.75. Okay, so unsa ang imuhang tawag ani? Unsa ang imuhang unit ana? That is ml. Okay, sa infusion preparation. So buot pasabot. Okay, sa 375 ml, dili kung mag-iput into action man na nimo, lisod man, labaw na pagka ng dili accurate ang calibration, pwede na nimo siya himuong 3.8. Okay, round off. Okay, so unsa na yung mahitabo? Clear na to, ha? Okay. Kunyari, ang order is 50 ml. Diba? 50 ml. So, 3.8 ang imuhang preparation. 3.8 ml. Okay? So 50 minus 3.8, that is how much? Pila? Sige na ba? Tabangin niyo si Mamba. O, na-answer. Right? Yun yung mga Junakis. Eh? 4.62. Okay? 4.62 ml. Okay? So, ibig sabihin, dili 4.62. 46.2 di ay sorry si ma'am yun oy. So if this is 50 ml, okay? 46.2 nyari dire. 46.2 ang imuhang IV fluid and the remaining will be 3.8 ml now of your dopamine. Okay? That is how you are going to prepare for the infusion. Okay? 46.2 na IV fluid, NSS, D5 water, D5 LR, plain LR, or unsa pay i-order ni Doc na pang-combine. And your medication. That is now your infusion preparation. Okay? Okay, next. Nakuha mo na. Okay, nakuha mo na ang infusion preparation. Ready na ang imuhang medication. Naano siya sa burette. Okay? Unsaon na, eto na yun siya. Yung ginawa natin, that is already your dilution preparation, IV fluid and infusion preparation. Ngayon, if you are asked, what is the drug concentration? Okay? Ano ang order ng doktor na dose natin? Kunyari, ang needed dose natin kanina, di ba, is 150 milligram. Multiply by 1,000 mcg. Ma'am, sirs, kaning 1,000 mcg, this is constant. Because what? 1 ml is equivalent to 1,000 microgram. So constant na siya. If you are looking for the need for the drug concentration of your dopamine, your needed dose, yung pag-multiply natin sa patient's weight times 3, that is your needed dose, multiply it with 1,000 microgram, which is constant, over the diluted solution volume, which is 50 ml. Okay? So, tarungon og sulat ni ma'am. Needed dose natin kanina, that is 150, multiply it by 1,000, answerin ni class, over 50. How much? Meron na tayong answer. Unang answer, 3,000. Okay, thank you, May. So, that is now 3,000 microgram. Okay? So, this is now your drug concentration. Okay? Needed dose, multiply by constant 1,000, kasi nga 1 ml is equal to 1,000 microgram, over the diluted solution volume, yung i-prepare natin na 50 ml. So, ito yung result. Okay? So, next. Okay? Next. Sunod, ito siya class ha? Sunod-sunod yan siya. Okay? Mahaba-habang komputan. Okay? Next is for your rate of infusion. Okay? Your needed dose in milligram. Okay? Ang order ni Doc. Ilan ang order ni Doc? Kunyari, ang sabi ni Doc, give patient 5 microgram per kilogram per minute. Yan ang order ni Doc na ibibigay mo daw sa patient. 5 microgram per kilogram per minute. Prepared na ang medicine mo, meron ka ng drug concentration and everything. So ano ang gagawin mo? Your needed dose now becomes your what? 'Di ba 150 milligram, okay, times the body weight, which is 50 kg, times 60 minutes, which is constant as well, over your drug concentration. Drug concentration mo na 3,000 microgram. Ang result nito will be ml per hour. So, ilan? Paki-compute. Okay, 150 ml? 150 ml ba? Teka, sandali ha. Teka lang. Wait lang, wait. Masyadong marami ang 150 ml. Meron ata akong mali sa computation ko. Mali. Mali ako, class. Kasi hindi dapat siya 150. Dapat pala dito sa needed dose is yung 5 microgram. Sorry, my mistake. So, hindi dapat siya, hindi dapat to 150 ang needed dose. Ito yung 5 microgram pala. Sorry. Okay. Ito, may mali ako dito. This is mcg. Okay. Sorry. 5 mcg, doctor's order yan, sir. Yan siya, Shan. Okay? Sa problem, meron akong i-prepare na problem sa inyo. Okay? Na i-answer natin. Okay? So, ilan ang answer? So, if this is 5 micrograms, hindi 150, that is 5 microgram times 50. So, that is 5 what? That is 5 ml per hour. Okay? Yan ang magiging infusion rate ninyo sa inyong 50 ml na dopamine solution. So, yun ha. Okay. So, I will be calling someone to answer. Okay, sandali lang. Clear all problems. Okay. So, this is your what? This is your ayaw sa erase, ma'am. Bago na lang para mas klaro ba? Unsa may gusto nimo a formula? Na-erase na. Mag-solve na lang tabag-o. Sige, una kami. Ayaw na lang. May una na lang ka. Sige na, go na. O, ikaw una, May. This is your problem. Okay? A 60-year-old male patient has a diagnosis of MI and is currently admitted to the ICU. The doctor's order is to give 50 ml. The doctor's order is to give dopamine at 10 microgram per kilogram per minute with D5 water. Okay? Tapos, you are asked to prepare. Nakulang lang na ko og sulat dire. Prepare. Okay? Prepare 50 ml. 50 ml of the drug of infusion. 50 ml of infusion. Okay. So with this problem, okay, May, can you please start the computation? Gusto ka mag-share screen? Formula? Okay, sige. Ang formula, ano ko? Wait ha. Asa na ba itong formula? Okay, formula. Patient's body weight in kilogram multiplied by 3. Okay na, May? Okay, so going back to the problem. Murag maurag ihapon ni ay. O sige, going back to the problem. How much is the needed dose now for your patient? Yes, Bea, you're correct. Pila, May? Mawala si May? Unsa man? May? Nalibog ka? Needed dose pa lang tayo. Very good. It's 150. Okay, ngano siya 150 gani, May? Very good. Okay, it's only what? We are only going to compute the patient's body weight by 3. So this will become now your needed dose. Okay? Okay. Nag-una na si Jill. Very good, Jill. Dahil dyan, hindi ikaw ang tatawagin ko dahil alam mo. Dele. Okay, sige lang. Next, Allen. Allen? Allen? Ala, asa sila? Allen? Na. Sa quiz na to kay puros calculation, hindi akong buhaton ba? O say, ang problem ma'am, pabalik po. O sige, balik ka sa problem. Asa na tong problem? Uy. Taysa. This is the problem. Pwede po magtanong paano yung diluted solution volume sa drug concentration. Order yan siya ng doktor, yung ating diluted solution. Okay, for example, sabihin ni Doc na prepare 50 ml or prepare 100 ml, ganon, ng tawag nito, ng infusion. So yun yung magiging dilution mo. Sige. Wala si Allen. Gone by the wind. Braille. Braille.
Wait lang po, ma'am.
Ano, Braille?
Wait lang po.
Magan by the wind yun ning grado ni Allen ron. Ang next natin is, yes, the infusion preparation. Okay? After you have computed for the needed dose, your next step is to compute for the infusion preparation. Dan, you're correct. Braille? Correct din, Tin. Correction. Correct, May. It's, niya na, hulaton sa nato si Brian. Dili na to i-pressure si Brian. Kaya ba si Ma, ayun siya, Ma'am, na-pressure ka. Wala ko na-pressure. Yes, Steph, you're correct. Pwede ni mo siya i-round off yun sa class. Okay? Yes, Brian, correct. You are correct. It's 3.75 ml or what? It's 3.8. Okay? Pero pagka na ganing sa problem solving, ganing na to class, kunyari, maghatag kong quiz, mamura na ni mo ginaingon na mag-quiz with ka, ma'am ba? Siyempre, man jud na, mag-quiz man, yun, kipon na to mabalaan kung ano siya, kung ano yung result, yun lang. Huwag niyo muna i-round off. Okay, wag niyo muna i-round off. I-round off lang natin siya kapag actual mo na siya ginagawa. Pero since we are still solving, we will still fix ourselves with the decimals. Okay? Decimal lang muna tayo. Okay, wala muna tayong round off para dili. Okay po, ma'am. So sa exam, ma'am, or sa quiz, as is lang. Yes, as is. Kung 3.75, 3.75 yun siya. Nanigurado yung kasyan ba? Okay? Sige. Pero, nanigurado yun di siya. Tama jud na. At least. Diba? At least. Kabalo mo. Okay? So, next. Okay. Who will compute now for the drug concentration? Mangita ta. Ardel. Ardel? Okay. Ardel, can you please compute for our drug concentration? 3.75 ml ang infusion prep. Tapos, 150 kilogram ang imuhang, 150 milligram ang imuhang needed dose na answer na nila. Okay, go for your drug concentration.
3,000 po, ma'am.
It's 3,000
mcg.
Very good. It's 3,000 mcg. Paghandaan yun ni Ardel. Bakit? Kabalo ko tawagon ko ni ma'am. Bakit akong pangalan kay letter A. Sige. Okay, so 150 times 1,000 microgram, that is constant. Okay, over 50 ml, which is your fluid. Okay, preparation is 3,000 microgram. Okay, next, who will compute for the rate of infusion? Kita na po ta. Princess Aiko. Aiko? Tama si Ardel. Okay. Grace, taas ra kaayo siya, Grace. Correction, correct Bea. Just masyadong mataas. Nasaan na si Aiko? Wala din. Okay. Mga wala gid ni kay wala man mo di mawala ko ning inyong grado sa ako aron. Okay. Bing. Steph,
Yes,
you're
ma'am.
correct. Faith, masyadong mataas. Hindi hindi yan. Bing, masyadong mababa. Nasa na si Bing?
Yes, ma'am.
Okay, Bing, can you please compute for our rate of infusion? Hindi, just. Rate of infusion natin, Bing. Yes, Christine, you are correct. Antayin lang natin. Yes, Dan, you are correct. Antayin natin si John Rommel.
Ma'am, nag-chat na ako sa iyo, ma'am.
Ha, nag-chat ka? Asa may chat?
Sa chat box po. Direct message po, ma'am.
Wala man. Wala.
10 ml po, ma'am.
Ilan?
10 po.
10 ml is correct, Bing. Wala lagi kay gi-chat diri sa kuha. Oh, promise. Oh.
Ilang...
Ma'am, takot siya ni chat.
Ay, my God. Oh my
Ala,
God.
sorry.
Oh my God. Bing, yung totoo. Kinsay mo
Ma'am,
maestra.
Ma'am, pero yung mag-conception, ma'am. Maglibog ko, ma'am.
Naawa lagi ba? Kaujud karon Bing. Okay. So, the correct answer is 10 ml. Okay? 10 ml kay your needed dose. Ani yun si Bing, no? Kasi tanan na lang conception. Kasi mamarani ba? Atik lang, Bing. Okay? Your needed dose in microgram. May mistake niya. It's mcg. Multiply by your weight in kilogram times 60 over your drug concentration, which is 3,000. That is 10 ml per hour. Okay? So, with that, I will ask 2 persons, okay, who will compute everything. Okay, who will compute everything. Okay? Now, wag ta. I have 2 problems. Okay. Nay, gusto mo volunteer? Ma'am, ngano na? 10 po siya. Na-loss sa translation po, ma'am. Okay, sige. Let's go back to your senses. Charot. Okay. Bakit siya naging 10? Okay. Remember that your needed dose is 10 microgram or this is the doctor's order. Okay? Microgram. It's 10 microgram. Di ba? Balikan natin yung problem. Okay, your problem is, okay, states here that the doctor's order is 10 microgram per kilogram per minute using D5 water. Okay, so balik tayo doon sa rate of infusion. The needed dose or para dili na lang mo malibog. Okay, anuhin na ako. Okay, doctor's order na lang na. Para dili siya libog.
Ma'am,
Oh,
dili dahil siya dito sa kuan, ma'am, dito sa patient's body weight times 3.
dili. Doctor's
Isa
order.
dito.
Rate of infusion naman ang ginapangayo sa atua. Okay?
Okay, ma'am.
So the doctor's order that is in microgram,
MCG na po. Okay.
yes. It's MCG na. Dili, mali ni nako. May mistake ni. Crash out ni. Okay?
Thank
Crash
you.
out. Okay. Doctor's order multiplied by the body weight of your patient times 60 over your drug concentration. Kasi we are looking for the rate of infusion. Kaya naging 10 ml per hour. Okay? Sorry lang. May mistake ang sa PowerPoint. Okay? So, doctor's order na siya. Doctor's order. Uy, dili man basta ka na, doctor's order. Okay? So, sige. Mangita na ko kinsay mo answer. Okay. Shan? Shan?
Yes po, ma'am.
Okay, I want you to solve for this problem. Tanan ha, gikan sa tawag ani ni the dose until rate of infusion. Okay? And I have another problem here. Okay? Solve. Ay, sorry, Shan. Okay. That is the problem for you. Okay? 50 ml pa din, Shan, ha? Prepare mo in 50 ml pa rin.
Yes po, ma'am.
Okay. Okay na, Shan? Pakita ko yung second problem para makasolve
Okay.
sila.
Okay na po, ma'am.
Okay. This is the second problem. So, lahat kayo mag-solve. And then I will call one. Okay? After ni Shan mag-share ng kanyang solution. Okay ka na, Shan?
Wait lang po, ma'am.
Okay, sige.
Ma'am, nalang po
Yes.
i-clarify kaning sa pag convert sa pounds to kilograms. Di ba, ang gamiton man kay 2.2.
Yes, it's 2.2.
And then, ang answer kay i-round off na mo siya to whole number.
Decimal lang muna. Huwag ka muna mag-convert.
Pag sa timbang, ma'am.
Oo, sa timbang.
Okay po, ma'am. Thank you.
Okay na, Shan?
Hapit na gid mo.
Hapit na? Okay, sige. Mag-stop share ako ha. Tapos i-share, ipaano kita. I-share mo ang screen mo.
Ay, wala ko sa kuan nag-solve, ma'am. Sa papel
wala
ko
ka?
sa papel ko nag-solve.
Okay. Sige. Sa papel ka nag-send. Sige.
Human ako, ma'am, pero dili ko sure sa akong answer kay katong sa pag-round off manggod. So nagduwa akong answer katong naka-round off ang timbang o katong wala naka-round off.
Okay, sige. Pwede mo siya i-screenshot ay i-picturean tapos i-send mo sa GC, at least may guide ang mga classmate mo paano mo siya i-solve. Okay.
Sige po,
Kaya
ma'am.
siya?
Ay, opo, ma'am, pero wala ba yung solution akong papel, ma'am? Diretso lang answer akong papel.
Diretso lang. O sige, ayaw na lang. Sige. First,
Sige po.
let's discuss first your drug needed. Ilan?
Ano, ma'am, katong na round off kay 246 niya, katong wala naka-round off kay 245.5.
245.5? Di ba?
Opo.
It's 2.45.43 lang.
Sa ano yan, di ba, ma'am? Yung sa...
Di ba, pounds to kilogram ka. Di ba? That is
Opo.
180 pounds. Divided by 2.2, that is 81.81. Di ba?
Yes po, ma'am.
81.81 kilogram. Okay?
Ay,
So,
81.82 akin, ma'am. Kay
ilan?
81.82.
Okay, 81.82 mo. Okay, no
Opo.
problem. It's just the same. It's a matter of point lang naman. Okay. So 2.46 or 2.45.40.5 is correct. Okay. What about your infusion preparation? How much?
Yung sa
Doon
wala
ka na lang sa 245.5.
Okay. Ano po, ma'am? 3.07 ml.
Ha, ilan?
3.07 ml.
3.07 ml.
Opo, ma'am.
246 ang gamit mo, no? 246.
Ay, yung ano po,
245.
Opo.
245.5 times 5 ml divided by 400. 3.06 or 3.07 is correct. Okay, next. So, ilan ang iyong IV fluid? How many ml? If it is 3.07.
Ano, ma'am? 50 po. Ay, yung available volume ba?
Oo, yung volume. You are asked to prepare 50 ml. So, if your dopamine is in 3.07 ml, how much is your IVF, which is D5 water?
Ay, wait lang po, ma'am. 46.93.
46. Very good. Is correct. Okay. How about your drug concentration?
4,910.
4,000.
910.
Okay, good. Next, your rate of infusion. How much?
5 ml po.
Correct. Okay, that is correct. Thank you, Sean. Okay,
Thank you,
for the
ma'am.
next problem. I have Jazz. Jazz, maka-share screen ka?
Sa paper ko lang din siya di-solve, ma'am.
Sa paper mo lang din gisolve. Okay, sige. Okay, i-send mo na lang, sige, huwag na lang, para diretso na tayo kay alas 4 na hapon. Okay, how much is your, How much is your drug needed?
163.65 po.
163.65.
65.
120 pounds ka, di ba? 120 pounds divided by 2.2, that is 54 point.
0.50. Ano ko siya, ma'am? 0.55.
0.55 mo. Okay, sige. So 54.55 times 3. 163.65 is correct.
65.
Okay. Next is your ano yun? Infusion
Drug.
preparation.
4.09 po.
4.
09.
Very good. That is correct. What about, so if 4.09 ang iyong medication, how much is your fluid?
3273 po.
3273.
3.
Very
3.
good. That is correct. Okay. So how much now is your rate of infusion? I know your drug concentration.
10 po.
No, drug concentration muna tayo. Just 3. Ilan yun? 3, 2.
3273 po.
3273.
Drug concentration. Didiretso ko siya, ma'am.
Diretso mo?
50 ml?
Oo, 50 ml.
Ay, okay. Didiretso ko lang siya sa computation, ma'am. Para makuha na yung ano.
Diretso mo na. Okay lang naman. Actually, a matter of decimal lang naman. Okay? But how much is your rate of infusion?
Yan na yung 10 po.
10 ml per hour. Tama?
Opo.
Okay, so that is correct. Okay? So, thank you, Jazz. Thank you, Sean. Okay? Class, tandaan ninyo. Okay? Sa problem solving natin, okay? Okay, sure man dyan ko na mag-quiz yun ko. Okay? Huwag ninyong kakalimutan ang tawag nito, yung steps kung paano kayo makakompute ng mga medicines ninyo. Okay? Kasi pwede mo mawala, Ana. Okay? Pwede mo mawala kapag meron kayong maligas. Labaw na kapag parehaan na, very particular ang computation kay. Siyempre, ano man ta, kumbaga, we are only doing the theoretical. So, sulat-sulat ta, computation. But in actual, of course, we will convert it. But since we are doing the theory, so stick tayo sa decimals. Okay? So actually, we still have one more medications to be discussing, but we are running out of time. It's already 4 o'clock on my end. Okay? So this is about dobutamine. Okay? This is about dobutamine. So by next week, okay? By next week, we will be on asynchronous class. Okay? So expect that I will be giving quiz on Kuiper. So ang quiz natin about emergency drugs, including the dobutamine, I will give you a handout to study. Okay? Not the same with the PowerPoint, but it contains everything, even my rationalization. Okay? For the emergency drugs. And for next week, since we will be on asynchronous and cupping and pinning, cupping and pinning ceremony sa ating 3rd year and 4th year, so we will not have any classes on that sa amo nga part. Okay? Kasi nga meron kaming mga roles doon. So I will be giving you a study guide. Okay? Just the same with the dobutamine. Just go for further research and study as to what? Anti-TB medications, pain, yung mga analgesics natin, and mga steroids. Okay? Mga for anti-inflammatory natin ng mga drugs. Yun ang ating assignment. And then, studihan ninyo. Because the week after next week, I will be giving you quiz that will go out on the study guide that I will give you about what? Anti-TB, pain medications, and anti-inflammatory. Okay? Yung Dobu natin and other emergency drugs, next week ko ibibigay ang quiz. Okay? Para meron kayong activity. Ma'am, di man na mo kailangan activity. Sige lang, okay lang na siya. Pampabribe. Okay? Pampabribe sa mga junakis. Okay? So, nag-ulan sa Midsayap. Okay, sige. Noted, Allen. So, because of that, Allen, can you please lead our closing prayer? Allen.
Hello, ma'am. Marinig po ako, ma'am.
Okay, yes, marinig kita, Allen. Len, lead our closing prayer.
Okay, for the Catholics, in the name of the Father, of the Son, the Holy Spirit, amen. Lord, we thank you for this wonderful day. We thank you for giving us the time. We thank you for our instructor for today, for she have imparted her knowledge with us. May you give us wisdom and guide us as we continue our class this afternoon, and may all the learnings that we gained today may be instilled in our minds. This we ask in the name of Jesus. Amen. In the name of the Father, the Son, the Holy Spirit. Amen.
Thank you, Allen. Okay, class, you are all dismissed. Thank you for this afternoon. Bye-bye.
Thank you, ma'am.
Thank you, ma'am. Bye-bye.
Po, ma'am.